For the first time, the FDA has approved a medication available to help slow the progression of Alzheimer's disease.
Joining us now to talk more about this is our 9News health expert, Dr. Payal Kohli. Good morning. It's always good to see you.
Such an exciting development, isn't it?
What sets this drug apart from what we already have?
So, if you think about Alzheimer's, it's really deposition of amyloid protein or plaques in the brain. So what this drug, which is an antibody that goes in IV every 2 weeks, does is it goes and sops up those plaques. So it prevents deposition of that protein in the brain. And that's what makes it really special, because it's the first drug that we've really found to change the trajectory of the disease of Alzheimer's.
It's such a big deal for the Alzheimer's community because there's really nothing like it on the market. But some people have talked about the downsides, the health effects to it as well.
That's right. So, we're just starting to learn some of those effects. And the data that we have so far suggests that there's some percentage of people, about 13% of people, that'll get brain swelling, and about 17% of people that can actually get bleeding into the brain. Now, if you look at the longer term studies of this drug, there are a few people that actually passed away and died as well. It's not clear whether it was related to the drug or unrelated to the condition. But when you're trying to really weigh risk and benefit, you're talking about not just the commitment to go to an infusion center every 2 weeks, but the possibility of a life-threatening complication. So it really does make it a difficult decision.
Is there a group of people that this drug would be the most effective for versus others who it may not help as much?
So who it's been studied in is mainly people with Alzheimer's with mild cognitive impairment or plaques with mild disease. Now, it doesn't mean that people with more advanced disease might not benefit. We just don't know. We don't have that data yet. Now, there's some people who have signal for harm who might actually do worse. And the FDA has put these people into what's called a black box warning, that you got to be extra careful. So these are people who may already be on blood thinners, because it can cause bleeding in the brain. These are people who may have 2 copies of a gene called an ApoE4, which is associated with Alzheimer's, that can make them higher risk for developing complications as well. So they are recommending genetic testing before you start this. It's not required, but it's recommended, so we can really try to determine who's most likely to benefit versus someone who might have harm.
This is for people typically in the early stages of Alzheimer's, but those that were in the clinical trial, they saw a big benefit to this.
They saw a benefit of about 27% over 18 months. Now, some would argue that that's not clinically significant. And what we're talking about here is, grandma may be becoming a little less forgetful than she was before. It's not that she's suddenly going to start remembering things and do better. The decline is just going to be a little bit slower. So that's where we really have to sort of try to understand, is it enough of a benefit that we should, commit ourselves to the potential of the risks as well as the cost of the drug, which is substantial. But for someone with Alzheimer's, it's really their only hope.
Yeah. What about the cost of this drug? Is that going to turn into a barrier for some folks?
I think it is, and this, as a physician, just drives me crazy because it's something I struggle with every day. You want to bring the latest science to these people. You want to do it quickly. But I think the drug companies and the insurance companies really have to step it up, because by making the cost prohibitive, which in this case is about $27,000 a year for this medication that just slows the disease, doesn't cure it, it really does put up a big barrier for people to get it. And so I really feel like this calls for legislative change where we should require insurance companies and drug companies to make these kinds of medications affordable.
Yeah, how heartbreaking would it be if you had almost had access to this and then that's what stops you from being able to slow this down?
I see this every day in my office. You have medications and the insurance companies put up roadblocks. In fact, Medicare earlier this year refused to cover this drug, even though it had received approval in January, because they said, well, we don't know if it just clears the plaques or also does the cognitive stuff. But now that they have that, hopefully they will cover it, but cover it at a price that people can afford.
Yeah. All right, Dr. Kohli, thanks for coming in.